Hi, everybody. Thank you so much for joining us for a webinar on the Child Care and Development Fund Final Rule. This is an exciting time for us, and we're very happy to have you joining us. We always inevitably get the question when we do these webinars about whether or not the slides are available. And in fact, the slides are available, probably on the exact same page where you accessed this webinar. So feel free to access those slides. If you have any issues finding them, feel free to let us know. In the meantime, we will get rolling. We've got a lot to cover. So without further ado, I will introduce our Deputy Assistant Secretary for Early Childhood, Linda Smith.
Okay, well, thank you, and I want to welcome everyone to the webinar today. This is truly a great day for child care in our country, and one that we have waited a long time to be able to have. Today you're going to learn the details on the new child care rule, which has just been put on display for everyone to look at. This rule and the reauthorization of the Child Care and Development Block Grant have been a good 18 years or more in the making. And so it's a very important day for us, as I said. In terms of what you're going to learn today, you're going to learn some of the changes that were made since we published the original notice of proposed rulemaking, and a number of other things that we hope will be beneficial to you as you do your work. There are many people that I want to thank before we get started on that, and I think starting with those of you who are out there in the states or the national organizations that have worked tirelessly for many years to get this reauthorization done and to get us to where we are today. A special thanks to two senators, Mikulski and Burr, who really shepherded this bill through Congress and in a bipartisan way that I think we can all be proud of. So I think those are very important thank yous that need to be said. And finally, to those of you who work on this in the states, for all of the input that you've given over the years in helping us make this happen. So now we're going to move to what did happen. And as you know, Congress reauthorized the Child Care and Development Block Grant in 2014, and it was signed into law later after the law was passed. It provides basically about over $5.7 million to the states, or million, what did I say? Billion dollars to the states in combined federal and state funds, which includes CCDF, TANF, and transfers included in that. This is a lot of money that's going out there for child care, and this last year we were fortunate enough to get an increase from Congress to help us pay for what's happening. We know we need more, and we're working on that, but just so you know, there was a commitment of Congress to make this bill a reality. The Child Care and Development Fund, which is basically our implementation of the CCDBG, serves over 1.4 million children per month under the age of 13. In nearly 1 million low-income families. It's a very important driver of child care and child care quality throughout this country. We said 1.4 million children benefit from this, but so many more benefit from the spillover that happens because of the rules and requirements that you're about to hear about. So more families are going to benefit from this than just the 1.4 million. I think as you listen to the details of this, you're going to see one thing that I hope is apparent and that I talk about often and repeatedly, and that is that this rule now will put into place what I call a foundation under child care in this country. Something we have not had in the past, and we need that foundation on which to build a better house, if you will, or a better program for our child care community out there. So I see this as a foundation. So what you're going to see now as we move from the proposed to the final rule is what actually happened as a result of the comments that you all made. We received a number of comments. We appreciated the groups working together to provide consolidated comments because we probably could not have gotten through this process without your help on that. We received 150 public comments, which we have worked very hard to incorporate into this rule, into this final rule. I think that the next thing that I want to basically talk to you about is that what this looks like in terms of implementation. As you know, most federal rules are implemented 60 days after publication, and that will be true in this case, with the exception of certain pieces which are controlled by the CCDBG law itself. So some provisions will be delayed as required in the law, but compliance is expected within 60 days of implementation of the rule. And as you see on the chart in front of you, you see what those dates are for the states and for the tribes, and they do vary. So full compliance will be by September 30th, 2018, and we will begin monitoring our child care programs to the new requirements as of that date. So I think we've got a lot of work in front of us. We know that this has been, you know, a tough lift for folks, but it's, again, an important one. The final thing I want to talk about before I turn this over to Rachel is something that I think is also very important to early childhood across the board in this country, and that is because we've had the opportunity moving the Head Start performance standards through the system as well as the child care rule, we've had an unprecedented opportunity to look at these two rules and make sure that they are at least don't conflict with each other, but to the extent that we can, we've made them, we have aligned them so that out in the country, we will have better opportunities to have Head Start and child care working together. And as you heard me talk about earlier, I want to just put out there that we do see this as a continuum now with the foundation under child care, with this new rule, putting it in a position that we can begin to move child care to higher levels of quality. And that higher levels of quality and that goal is what we all want to see, more in keeping with the Head Start performance standards and what we have done there. So this continuum of moving things from one level to another, we hope is put in place with this alignment that we've been able to do. And as you know, we actually have done a lot of this work through the early Head Start child care partnerships. And we learned a lot from those, and those of you who have done those out there, we appreciated the input and your hard work in making those happen. So what are some of the things that we have been able to do in the alignment? Well, obviously, we have aligned the training, and Rachel will talk a little bit more about that when she talks about what that is. The Caring for Our Children Basics, both the Head Start performance standards and the child care regulation, refers to Caring for Our Children Basics, and these are what we think are the minimum health and safety standards that should be in place for all children. And then finally, the other important thing that we've been able to do is actually take from the child care block grant and put into the Head Start performance standards the same background check requirements that are required of child care are required of the Head Start community, so that they are again aligned to the extent that we can get them there. So we've had a lot of important things going on at one time, but moving this rule from where I sit to finalization is like seeing your career come full circle. And I get a little teary about that when I talk about it, because it's been over 40 years of working towards that. So with that, Rachel, I'm going to turn it over to you and have you talk them through the new rule.
I will do that, Linda, but first I do want to recognize you and all the work you have done on this over the many, many years, and how wonderful it has been to work together with you on getting this rule done. So that's been a fantastic process, and we're so excited to share the results with everybody on the phone today. And then I also just want to say, in this room we have an incredible staff that have worked many, many hours to get us to this point, and I never go without recognizing that work when we do talk about the rule and where we've gotten. So without further ado, we do want to get into the meat of this. And let me just preface by saying we have a lot of slides. And what we tried to do was to include basics from the law, so just in case folks need to remember what's in the law, and then also talking about where the rule came out. We will not dwell a lot on those slides that have the law in them, but we did want to include them as part of the rollout of this webinar and in the slides that folks might be able to download, as Tricia mentioned in the beginning, so you would have them all as a reference point. There are 4 key areas that we are going to talk about. We're going to start off with these health and safety regulations, which are so critical to the future of our children and what parents expect to be happening in child care programs around the country. The other areas, as you know from the NPRM that we put out, that we tried to really organize our rule into, are the consumer choices and access to information, talking about the equal access to stable and high quality child care for low-income children, and also enhancing the quality of child care and the workforce. These are 4 incredibly critical and fundamental foundations, that's the word Linda used, and I will say it again, that we hope will take our child care field and this program into a whole new phase. And we've been on this journey together for many years, and this is a new phase that's going to take us to the future. As you know, it's been 18 years since this rule was last updated, and so when we looked at this, we really thought about what are we doing here that's going to help us take this program into where we really want it to go and make sure that children and families that rely on childcare every day have some new protections and some stable supports that really realize the vision that Congress gave us in passing this law in 2014. We've taken all the comments very seriously, as Linda said, and we do hope that this is something that the field can embrace and run with, and we're very excited to share it with you. Okay, so it's hard to resist doing a little bit of introductory, even though Linda did such a wonderful job with it. So let's move on to the specifics. We're going to talk first about protecting the health and safety of children in care. And as I said, this is one of the major reasons that this legislation passed, was concern in Congress about what was happening around the country in terms of children's safety, reading reports about injuries and deaths in child care, and OIG reports that came out, Inspector General reports that came out that were concerned about the extent of monitoring that was really happening out there, and that they felt, Congress felt, we needed to do a little bit more to make sure there was a basic floor of health and safety. So you're all probably remember quite clearly the law required some basic things around why some programs wouldn't be licensed, basic health and safety requirements around training and monitoring, and but also allowing states the flexibility to exclude relative providers, and acknowledging that in some cases child care subsidy dollars go to relatives, and that they need to have a different, states would need some flexibility there. So where did the rule end up? We looked at this issue about licensing exemptions, and there's more clarification in the rule. It specifies that the description of licensing exemptions has to include more information about the category, type, or setting, the length of day, providers who are not subject to licensing because the number of children falls below a state-defined threshold, which is often the case in home-based care, where we know that a large category of providers that in one state would be considered licensed family child care, in another state, because the state has a different threshold, they would not be considered licensed. They would be license exempt because of the number of children. So we want to, the rule is going to specify that that information be included and any other exemptions to licensing requirements. As Linda mentioned before, we recommend Caring for Our Children Basics as a model baseline to help states in setting the minimum health and safety standards that will still be up to them to set along the 10 health and safety topics that are that we had required from the law. And we do hope that that can be useful. We have a lot of tools online, crosswalks and tools like that from our TA providers that can help states think about how to use those as a touchstone when they do their model baseline, their standards. And we know that states around the country have been saying, as soon as these rules are done, we are going to go open up our licensing regulations, and we hope that that tool is helpful for everybody. The other thing that we addressed in the rule that you remember from the law is in this slide, the monitoring requirements. So the law required licensed providers to have annual visits and pre-licensure visits, and license-exempt providers to have annual visits. And it also talked about some things that states needed to talk to in their plans, that they had licensing inspectors who were qualified, and that they needed to have a ratio that helped them meet this standard. So what did the final rule do? Well, first of all, we clarified, and this is something that was proposed as well, that the monitoring process must cover those 10 health and safety topics. You all remember them, I'm sure, things like SIDS, medicine administration, and other emergency procedures. Those are things that must also be addressed in the monitoring process. We also, in the rule, it allows differential monitoring or risk-based approach. So states do have that flexibility to design monitoring processes that will allow for basically figuring out which providers might need more or less attention, and reviewing on an annual basis, developing tools that allow them to judge a representative sample of the licensing standards, so that they can know that even though they don't check every single standard is specifically checked, that the monitoring visit is really indicative of the full range of licensing requirements. So that's something that several states have been working on, and we again have technical assistance tools to help states think about. The next thing that I wanted to talk about here is that the rule allows alternative monitoring requirements for care in children's homes. And this is really different than home-based care. This is when a caregiver is going into the child's home, and that care is paid for by the Child Care and Development block grant dollars. So the lead agency will have the option of developing alternate monitoring strategies for care that are provided in those settings. We understand that children's homes and the family aren't going to have to meet the same standards necessarily, and that we wanted to give states flexibility to figure out how best to handle what is required in the law in terms of annual visits in that different type of setting. So that is something that we think responds to comments that we received, and we hope that that will allow for appropriate and family-friendly monitoring processes in those types of settings, which are obviously more informal. The next slide is around criminal background checks. You all remember from the law that comprehensive checks will need to be completed by September 2017 for all child care staff members. And we clarified in the rule all licensed, regulated, or registered providers, as the law said, and all providers eligible to deliver CCDF-funded services. Now, there's more details on this, as many states have told me over the last couple years that I've been here. There's a lot to think about with criminal background checks, and the rule addresses some of the things that we have heard from states and commenters over the last couple years since the law passed. One thing I want to clarify, and that the rule states, is that a comprehensive background check includes, certain aspects, just as the law said, and specifics include the FBI fingerprint check using the Next Generation Identification, the search of the National Crime Information Center's National Sex Offender Registry, but we do clarify after guidance is issued by ACF and the Federal Bureau of Investigation. In the rule, we say this in the preamble. We also say that there's obviously needs to be search of a set of registries that were in the database, and registries and databases that states will have access to. And so we clarify that there were some overlap things in the law, and those things are clarified in the rule. We also want to point out that the rule includes checks on other residents age 18 or older in the family child care home. So these folks would be considered as part of the definition of a child care staff member, which was in what was required in the law for all those folks to be checked by a background check. And the reason this is here is because we know that there's a lot of unsupervised access that could occur when folks who are in the child care home are there on a regular basis and are over the age of 18, and we just want to err on the side of caution in terms of making sure that those folks have had checks as well. The final rule also includes contract and self-employed individuals in the definition of child care staff members, as they can have direct contact with children, but that doesn't include like a plumber who comes in one day to fix something. We get that question all the time. We're assuming that plumber would not have unsupervised access to children, and therefore I'm anticipating that's a question folks are having out there. These, as Linda said, are going to align with Head Start provisional employment requirements as well. The final rule allows prospective staff members to provide services to children while under supervision on a provisional basis after they've had their FBI fingerprint check or the search of the state criminal repository using fingerprints in the state where the staff member resides. So this is the same as Head Start performance standards. The other thing that the law said, and then the rule clarifies, is this issue of cross-state checks. So lead agencies in the rule are required to have requirements, policies, and procedures in place to respond as expeditiously as possible to other states and territories and tribes' requests for background checks. And that means that the rule also requires that all those entities have rules and procedures to deal with these types of requests. We do understand that this is something that folks are still working out the details on around the country, and that's why ACF recently announced a pilot project to develop a national interstate background check clearinghouse that will support lead agencies in meeting these cross-state background checks. And the goal of that is to really help all states and all of our tribes and territories that will be affected by this to be successful. And we do understand that's something that you've been thinking long and hard about. The next area of the rule to focus on is around consumer choices and access to information to support child development. This is another key thing that we are so excited about, the difference this could make for children and families around the country, because this is something that will benefit so many people, not just the folks that are receiving CCDF services, but all parents that are looking for child care. One of the first things that you will remember from the law is the requirement to maintain a consumer education website. The law requires that a set of information be available electronically, and so the final rule requires this list you see here, that these components be combined into a consumer-friendly and easily accessible website, and it also aligns with federal and state website requirements. So the final rule will allow for the state and what the state is collecting to line up with what the childcare.gov, which is a new requirement for the federal level to put together a website that allows for searching at this childcare.gov new site. This specifies that lead agencies will need to provide linkages to databases and other consumer education information as determined by the Secretary. The next slide is around some of the components of the consumer education website. It's not that simple. You can't just throw up a website and say, hey, we've got this. A lot of you I know have been working really hard around the country, if you're listening from a state, trying to figure out how to make sure your websites meet these requirements. So here's a chart that can help you think about this. The components that must be included are listed here along the left side, and there's some details there on the right. I know this will take a while for everyone to unpack, but the basic category you're all aware of is, state policies and procedures, all the things that are happening in the state around licensing, monitoring, and inspection, so that parents can figure out just how much licensing and monitoring has occurred for their provider and what they must meet in terms of requirements. They also then must include certain provider-specific information, including a localized list of child care providers with licensing status that's searchable by zip code, and includes the quality of a child care provider if that's available. So that would include states that have quality rating improvement systems or other types of ways for noting the quality of a provider. And they also need to make sure the results of monitoring and inspection reports are posted, and we do recommend that those are posted within 90 days. In the NPRM, we talked about, we proposed that all eligible and licensed child care providers be included in the website. We got a lot of comments on that, and then we listened to them. So we are now in this final rule allowing states to exempt license-exempt providers from the localized list of providers. We do think that access to health and safety records is crucial for parents to make an informed decision, so we have not extended that flexibility in that area for the monitoring and inspection results. The final rule does not require lead agencies to post provider-specific numbers of death and serious injuries occurring at the certain provider, as is in the NPRM. Although it's not required, it's critical that parents be able to easily find that information. And the final rule requires that monitoring and inspection results clearly display any health and safety violations that have been validated and substantiated, including fatalities and serious injuries, so that parents can find that information easily. States also must post at least 3 years of monitoring and inspection reports, and the reports have to have a plain language summary if the report itself is not in plain language. So that's 2 options for the way states can think about it. We recommend, as I said, that those reports be put up within 90 days. So there's other information here that's less complicated to explain. So I'm going to move on to the next slide since we have so much more to talk about. Okay, are you with me? Information for parents, providers, and the public. This is something, again, that just to remind you what was in the law and what was required around providing information about CCDF services, research and best practices concerning children's development, and state policies regarding social emotional behavior. So, in the next slide, we can see what the clarifications were that came in the final rule. For one thing, information on social emotional behavior should be for birth to school age or age appropriate. That was a clarification we thought was important, especially since our program serves children birth through school age. States also must describe policies to prevent suspension and expulsion, prevent suspension and expulsion. And that is something we thought was a good clarification since we have worked, and you are probably very much aware that we've issued statements and done quite a lot of work to bring attention to the challenges of suspension and expulsion, and we would expect and wanted to signal states would hopefully have policies to prevent that. Lead agencies may also consider the most effective ways to reach families, including partnerships with CCR&Rs. We wanted to make sure that, as you know, and you can see from the heading, the law said the information is available for parents, providers, and the public. So that's a new wrinkle, and that means there really is a lot of opportunity to think about who are the best messengers and what are the best ways to get this information out in a usable and accessible, culturally and linguistically accessible format to the wide variety of folks out there who could use it. The next slide is around information on developmental screenings. You all remember the law required lead agencies to provide certain information on existing resources and services and provide information on how a family provider may use those resources. In the final rule, we require resources about developmental screenings to be provided during the CCDF intake process. So that means those families who are coming in to receive child care assistance would have access to resources on developmental screenings, which is so important for early detection and treatment for children who may have hearing problems, vision problems, developmental delays. We really do want to make sure that we especially get that information into the hands of our folks who are served through the CCDF program. It also requires that information be given about developmental screenings through training and education to providers. And we recommend, but do not require, that all children receiving CCDF get a developmental screening within 45 days of enrollment. That's in alignment with Head Start, as many of you are aware. So the consumer statement. The final rule requires a consumer statement for CCDF parents, but we do want to clarify that we understand that there are ways that they might deliver this that could include getting the parent access and ensuring the parent has access to the consumer education website and other existing resources to provide this information. So that's new and something we wanted to clarify through this final version of the rule. It's particularly important that this information get to parents receiving CCDF, so we do require CCDF parents to be provided with a consumer statement. It's not intended to necessarily change what a parent is choosing if they have a particular provider that they want, but we do want to make sure that they have all the information and are aware of the last date of inspection, the regulatory requirements that the provider must meet, all these types of things that can really inform their choice. And so we want to make sure that those things are available. The thing that we want to, so then I already said this, but let me just say again, we do recognize that there are different ways that states may do this, and lead agencies can take a look at their website and figure out if there's a way that they can make sure that access happens. So that will be something that allows a little more flexibility to how states can implement this. Okay, providing equal access to stable, high-quality childcare for low-income children. You all know that one of the new purposes of this law is to increase the number and proportion of low-income children who have access to high-quality childcare, and we take that very seriously. We see a lot of things that Congress put into this law around the eligibility periods and other things around the subsidy program that could really make a huge difference in the types of care that these children are able to access and the stability that families are able to have. So when I go first here through the law, and then we'll get into some of the specifics, because we know that there are a lot of things in the law that folks had questions about. So the law established minimum 12-month eligibility periods regardless of temporary changes in parent status or work or attending job and training or education, as long as the family income does not exceed 85% of state median income. And you all know 85% of state median income is the federal maximum that is set by law. So states have the opportunity to set the maximum lower, but for this 12-month period, there is an 85% of SMI maximum. Now, continuity of care is so critical for our children and families who really need stability in their lives. And so when we took a look at this lengthened eligibility in the final rule, there's a few things that are clarified to share. For one thing, the final rule clarifies that the minimum 12-month eligibility applies to initial and subsequent eligibility periods. It also defines temporary to conclude, at a minimum, specific time-limited absences for work or school, any reduction in work, training, or education hours, and other changes to work and education and job training that do not exceed 3 months. We think this aligns with the 3-month period that is also articulated separately in the law around job search. So that is one of the things that we took into consideration here in this clarification. The rule also prohibits shorter authorization periods within the 12-month eligibility period. So that means the law said 12-month minimum, and we immediately got a lot of questions about the difference between eligibility and authorization. And for the purposes of this rule, we are clarifying that there should not be a difference, that authorization periods cannot be a way to make families actually continue to get less than the minimum of 12-month eligibility. And more to say on lengthened eligibility in the final rule. The final rule talks about this period and tries to get at the issue of what type of situations could come up. We got a lot of questions about this. So we heard that there were circumstances where a lead agency might have legitimate reasons for ending care prior to the end of the minimum eligibility period. And we really thought about those and tried to figure out what was reasonable to include and what might did not conflict with the intent of the act. So there's a few areas that are in the final rule that would be considered permittable. One would be excessive, unexplained absences after attempts to contact the family. And so every effort would have to be made to reach the family and the provider and try to make sure that they were aware that they were potentially going to lose their subsidy. Another is that if the family moves outside of the state, territory, or tribal service area. And the third would be substantiated fraud or intentional program violations. These are reasons that states raised to us as appropriate reasons to limit the 12 months, and they made sense to us. For continuity during the eligibility period, we have a lot of things that we had to speak to really clarify how this would work on the ground, because we know there's a lot of devil in the details for these eligibility policies in states. So the law tried to protect families during that eligibility period, and then the rule will clarify some additional things. So on the left, you see the types of information that would be required from the family to prove that they're eligible at determination and at redetermination. So child age, family income, qualifying activity, and other information determined by the lead agency. During the minimum 12-month period, not all of that information is not going to be necessary. Families will be required to report only if their income is over the 85% of state median income. They also would be required or allowed, well, the rule requires that families be allowed to report changes at any time that the lead agency could then act on that would be beneficial to the family. So this would mean if something changed in their hours or their income, that would mean their copayment could be lowered. Those types of things we would like to continue to be reported, because that's a positive thing for the family and could help sustain their stability during that period. We really are doing this and thinking about this in terms of the intent of the law and the goal of helping families have a period of stability that allows them to get back on their feet and hopefully get to the end of this period and have an ability to be able to have experienced enough stability to make some positive advances in their work hours, and for their child to experience the same trusting relationship for 12 months. This is a great opportunity to make that happen. For flexibility for working parents, the law required lead agencies to take into account irregular fluctuations and not to unduly disrupt employment. And so these are some things that we also have in the rule, and some clarifications in the rule for working parents are in the next slide. So one thing that we have in the final rule is that states are not required to limit care to the parent's schedule. There's no requirement in federal law tying child care subsidy time closely to parental work, education, or training hours. We really know that when you do that, it makes it very difficult for a family to find care, especially if they're working non-traditional hours, of any type of stability. That if they're getting, 3 hours this week and 5 hours the next week or different times, it's going to be, the next day, it's going to be very difficult for them to find a provider that has fixed costs of providing care that's at a high quality level. It makes it very hard for them. So this provision clarifies that matching hours is not required. Lead agencies are encouraged to authorize adequate hours to allow children to participate in a high-quality program, which may be more hours than the parent is working or in education or training.
For expanding protective services, this is another thing the rule clarifies. It clarifies that the protective service category may include specific populations of vulnerable children as identified by the lead agency. So this is an area of increased flexibility. They do not need to be formally involved with the child protective services or child welfare system in order to be considered eligible for CCDF under that category. The rule also includes a provision that says that you must take child development into account in considering authorization and eligibility for child care. There's a lot of different ways that states can think about that. Lead agencies can think about this in terms of, as I said, access to a high-quality program, whether the child and family might benefit from being part of a program that coordinates with Head Start or Early Head Start, and to really think about what's best for the child. So, continued assistance before optional termination. The law gives states the option to end assistance prior to the end of the 12-month period, and this was an area of flexibility for states, recognizing that loss of work was something on states' minds, and how would they treat that in a 12-month period. So the law required that in this case, states must provide at least 3 months of continued assistance after such loss or cessation. And in this slide, we go on to talk about some of the things that were clarified. So continued assistance must be provided at least the same level, and that means that this will help prevent reductions of levels of assistance during this period that might undermine the statutory intent to provide stability for families during times of increased need or transition. There's no requirement to collect documentation. We also clarify that. During the job search period, there's not a specific kind of job search that's required. That's not something required through the rule. We also clarify in the rule that by the end of the 3-month period, if the parent has engaged in an activity that makes them eligible, their assistance cannot be terminated at that point. And also we clarify that lead agencies can still use job search status as an initial qualifying activity as long as assistance is provided for at least 3 months, and assistance continues if the parent then becomes engaged in an activity that would allow them to qualify at the end of the 3-month period. So, graduated phase out. This is something that we've had a lot of conversation about internally. We've heard a lot from folks around the country. The law requires lead agencies to have a graduated phase out policy and procedure for families once they get to the end of their minimum 12-month period and are at redetermination who exceed CCDF lead agency income threshold. So this is something that a lot of folks have said, what does this mean? And we proposed in the NPRM that this would mean that the second tier would need to be at 85% of state median income, but would give lead agencies the option to stop assistance after the first year. Believe me, we got a lot of comments around this, and there were a lot of concerns around that original proposal. And so the final rule looks different. And we have a lot of text on this because we want to make sure you have all the details of this change. The final rule says that lead agencies that establish initial income eligibility below 85% of SMI must establish 2-tiered eligibility. That second tier must be at either the 85% of SMI, as originally proposed, or an amount lower than 85% of SMI for a family of the same size. But that there's some few things we want to be taken into consideration, and when states go ahead and take the second option. They need to take into account the typical household budget of a low-income family, and they need to provide justification that the second eligibility threshold is sufficient to accommodate increases in family income over time. So we want, the original idea of the graduated phase-out is to make sure that families don't go over a cliff, that they don't suddenly get a small raise that results in a major increase in how much they have to pay for childcare if they lose their subsidy. So you'll see that in this provision, what we have here is the second sub-bullet says that it also reasonably allows a family to continue accessing child care services without unnecessary disruption. We also had previously proposed and continue to say that lead agencies may increase co-payments during the graduated phase-out period. So we strongly encourage that lead agencies establish their second tier at 85% of SMI. A number of states have moved to this. It really maximizes continuity of subsidy for families, but we know that states commented that they had some concerns about this. So this is why we have this new area of flexibility. We're very interested in seeing states think about these conditions, however, in terms of that family income is sufficient and the family is able to continue accessing child care without unnecessary disruption. So we would want states to think about the difference between the first and second eligibility tiers, make sure that difference is sufficient to accommodate increases in income over time, and really that also take a look at whether they're able to sustain child care. Eligibility processes and error rate is the next area that the law took on, and the rule clarifies a couple things about what was required by the law. One of them is that family circumstances changing during the eligibility period should not be considered errors or improper payments, unless the income goes above 85% of SMI, which is of course the federal maximum. The other thing is that a child experiencing homelessness or a child in foster care is permitted to initially enroll but is found to be ineligible once all documentation is submitted. That should not be considered an error or improper payment, because that is an area of particular focus of the law in terms of giving homeless families access and an opportunity and grace period to initially enroll. So moving on to the homeless provision specifically, you remember this from the law. Grace periods, as I just said, were allowed, including for health and safety requirements. There's a requirement for training and technical assistance, outreach, coordination with other programs, and new data reporting. In the final rule, the homeless provisions were clarified. One thing that we had proposed before and continued to say is that the McKinney-Vento definition used by Head Start and the Department of Education would also apply to this rule. We also clarify that children experiencing homelessness shall be given priority for services, and require that lead agencies coordinate with other relevant agencies to help families receiving services during the grace period to comply with immunization and other health and safety requirements. We would want to make sure that during that grace period, those health and safety needs are taken care of. We also specify that grace periods shall be established in consultation with the appropriate health agency. We know there are some that in your states you work really closely. You might have your health partner on the line right now if you're the lead agency, and you need to work closely with them, and probably already have been, and in fact told us we should say that, in terms of making sure that any changes to health and safety requirements for homeless families are done with the appropriate information about how to maintain public health. Equal access. In the law, we had several provisions that are meant to ensure equal access. Equal access, as you know, has been a major piece of the Child Care and Development Block Grant since its first inception. The law continues to require lead agencies to certify that payment rates are sufficient to ensure equal access and provide a summary of facts used to determine that payment rates are sufficient to ensure equal access. In the final rule, we have some more information about that. The final rule requires CCDF lead agencies to provide the summary of facts in its plan with some new provisions. So you see in number 2 here, it says how payment rates are adequate based on the most recent market rate survey or alternative methodology. That was information, that was a new area of flexibility provided in the law, that alternative methodologies could be used. In addition, that we have in here that states would write to how base payment rates enable providers to meet health, safety, quality, and staffing requirements, and how the lead agency took the cost of higher quality care into account. We also have in the rule that provider practices, how payment practices to providers support equal access to a range of providers, and how and on what factors the lead agency differentiates payment rates. So this is, many states already do this. This is where they might pay more for a care that they're trying to encourage, a type of care like infant toddler care or non-traditional hours care, or they might pay higher for quality. And that information will all need to be included according to the rule. So the next slide is more about, digs in a little deeper about payment rates. As I said before, and as you all recall, the law gave the option of alternative methodology. The final rule requires lead agencies to address these things and provide the summary of facts in their CCDF plans, including how the choice of full range of providers is given and adequate payment rates based on the most recent market rate survey and alternative methodology, and several other things. So we're going to have a lot more information to look at. With the base provider payment rates, we do require that the states submit their alternative methodology to ACF for advanced approval, and to look at variations by location, category of provider, and child age, and track provider participation in CCDF. We're hoping to get more information about barriers to participation and whether providers charge above the copayment. So this is where the amount that the parent pays actually includes a differential between the copayment that is required under the state's rules and the state's payment level. Okay, so family copayments. Going on to this particular thing, family copayments, as you know, are a big piece of what makes childcare accessible and affordable for children and families around the country when they're part of our system. Under the rule, it prohibits lead agency from increasing copayments within the 12-month eligibility period. And this is, as I said before, not the case during the graduated phase-out provision. It's only during the 12-month eligibility period. The rule continues to recommend a new benchmark of no more than 7% of a family's income going to the copayment. Now, this is still a recommendation. It is not a requirement. States still have flexibility to set their copayment levels. However, we did want to recognize that national data show that 7% on average is what families pay towards childcare, and we wanted to suggest that that be also true for low-income families so that they don't have a disproportionate amount of their income going to pay the cost of care. We allow for waiving of copays for families that meet criteria established by the lead agency. So in addition to families below poverty or protective services, and this is something that we think will be some flexibility that will help with particularly in cases where states want to encourage partnerships, early Head Start child care partnerships. It might be very positive for those types of situations, and we think that that will be helpful. And last but not least, we prohibit copays based on the cost of care or amount of subsidy payment, and this is because we want to make sure that higher cost care, which also sometimes is more high quality, is not harder for our low-income families to access. Improving payment practices and provider stability. We have a lot of specific provisions in the final rule that require lead agencies to demonstrate things in their plan, and some of these are things that you have seen before. For example, to ensure timely payment, the final rule requires lead agencies to ensure timeliness and to describe in their plan how they will provide that and how that will happen. And they can do that either by paying prospectively prior to the delivery of services or paying providers retrospectively within no more than 21 calendar days of the receipt of a completed invoice for services. And we base this on data that we collected from states and what their practices are currently. For absence days, you remember the law says to the extent practicable, we need to link provider payments from children's occasional absences to because this is something that, you know, as a parent, when your child is sick,
you continue to pay for the care. You don't get to say, my child's sick, I'm not paying for today. And the provider has to still pay their staff for that day, even though your child didn't come. And so for what we're going to ask, what the rule requires lead agencies to do is to consider one of 4 options. They can pay based on enrollment rather than attendance, provide full payment if the child attends 85% of the authorized time, provide full payment if the child is absent 5 or fewer days, or an alternative approach that's justified in the CCDF plan. There's also provisions around providing payment for any services in accordance with payment agreements and authorization. So in this case, we're talking about generally acceptable practices. This is including paying providers based on established part-time or full-time rates, and paying for reasonable mandatory registration fees that the provider charges to private paying parents. I think this is a change that we also got a lot of comments on around our original language. So the new language says that there's a need to pay for reasonable mandatory registration fees that the provider charges to private paying parents. Is not as extensive as it was in the MPRM. Another thing that we have in the rule related to improving payment practices and provider stability is around ensuring child care providers get prompt notice of changes to a family's eligibility, so they're not left holding the bag and realizing that they're out salary and other things, and because they didn't realize a child was actually no longer eligible. So the final rule requires certain other generally accepted payment practice for all lead agencies, and that would include ensuring that child care providers receive payment for any services in accordance with payment agreement, ensuring that the child care providers receive prompt notice, and ensuring timely appeal and resolution processes for payment inaccuracies and disputes. Okay, so last but definitely not least is the section of the final rule. I almost said the MPRM. The final rule on enhancing the quality of child care in the early childhood workforce. It's last but definitely not least, because boy, has there been a lot of attention to the issue of the early childhood workforce in the last years since the law passed. And our own Office of Early Childhood Development put out some great information about how salaries and compensation and teacher education and training vary from state to state, and we're really interested in seeing more of a career pathway for our early childhood teachers, caregivers, and directors, so they have an opportunity to advance their skills and have the competencies they need to really promote the development of our young children. And as you all know, quality expenditures that states have under the block grant are actually for all children. They're not just for the children that are in the Child Care Development Fund subsidy program. So the focus on quality improvement in the law, as you know, next slide, is a gradual increase over a 5-year period in mandatory quality set-aside that's going to grow from 4% annually to 9% by fiscal year 2020. And there's a new, very exciting infant-toddler set-aside starting in fiscal year 2017, which really is important given that we know that the supply of infant and toddler care and the quality of our infant-toddler workforce remains the lowest and the least qualified and the least compensated among our early childhood workforce, and yet we know so much about brain development in the first 3 years. It's really a critical focus. The Office of Child Care is very excited to host the Infant Toddler Strategies Institute this year with folks from all over the country coming to focus in on this issue, and got a lot of energy and excitement about it. So we're continuing to be thrilled that this is something that Congress put in the law. And here you see a cumulative chart showing how those numbers will grow over time, resulting in 12% total quality set aside by FY 2020.
And so this is sort of review, but you all know that the law said that lead agencies must spend their quality funds on at least 1 out of 10 specified quality activities, although Congress did allow for the 10th to be other measurable quality activities, and they're listed here. So they're all the types of things that have been typically used by states for these types of purposes over the last set of years. What we want to focus on now is that reporting on quality improvement is going to be something that continues, and the law required states to report annually on quality activities, including the expenditures, what they're spending on, and measures that they're going to use to evaluate those activities. The final rule requires an expenditure report and a quality progress report about those quality investments. And we have already thought about how to do that through our 696 form, which is our expenditure data form. And we are in the process of revising and soon should have out for comment a revised quality progress report, which we will be very interested in folks' thoughts on, which we hope will help meet this requirement that was new in the law, but use a familiar process for states to meet that requirement. So building the supply of high quality care, the law requires a set of things around this area. It's very exciting. People are really thinking about this around the country. How do you use different strategies to increase the supply of care for kids in underserved areas, infants and toddlers, children with disabilities, and children who receive care through non-traditional hours? The final rule clarifies that states must include information about the shortages in supply of high-quality child care providers, list the data sources used to identify shortages, and describe their method of tracking progress to support equal access and parental choice. We also want to talk about the training and professional development requirements in the law, another key piece of what we need to do for our workforce. The law requires these sets of things: pre-service orientation, training within 3 months, creating a progression of professional development so that our dedicated staff can increase their skills and increase their professionalization and hopefully compensation, and provide assurances that training and professional development will improve the quality, diversity, and stability and retention of the workforce. We have continued to focus on this issue, as you know, and we recently issued a early childhood career pathways statement from Linda Smith's office, the Office of Child Development, really articulating what we hope for the future of the progression of professional development in this country. The final rule clarifies that ongoing accessible professional development is aligned to a progression, as we said before, and that we really want to see, in particular, our staff that are in CCDF programs to have an opportunity to advance on this progression. To the extent practicable, we continue to say in this rule that that would include a CEU or college credit. And I think this slide is best taken together actually with the next one, and it does say continued in some way. So the final rule also clarifies some more things. Now, we really needed to clarify that pre-service orientation issue. We got comments about what that means. So one of the things that we clarify in the rule is that that applies to CCDF providers, caregivers, teachers, and directors. So for providers, it's not one person in a location. It's all caregivers, teachers, and directors. There are definitions of what we mean by teacher and director, and we also want to point out that, as in the NPRM, we add child development to required training for our caregivers, teachers, and directors. So this type of knowledge, we've heard over and over again that it makes a lot of sense to make sure directors have similar training as their teachers so that they can support them, or have an idea of how the director can organize their program and make sure that the teachers have the ability to implement the things that they learn in their training, and that's why they're included in this definition. We also say that in order to reduce unnecessary duplication of time and resources, that to the extent possible, training be aligned to the state framework, which includes professional standards and a career pathway. The state framework is defined and encouraged through our language in the preamble, and we do really want, again, to clarify that one of the major things that's going to change is a lot of people are going to get basic health and safety training, and it would be a shame if that weren't aligned to the rest of a professional development system and allow for an ongoing growth of training and development. So which provisions apply to tribes? If you're watching this webinar, you may have noticed that we also have a completely different one that is dedicated to the tribal provisions. It will provide much more detail. So do go to that to get more information. But we did want to at least share some basics about how the rule applies to our tribal partners. The final rule establishes 3 tiers of tribal grantees based on the size of their allocation. You may know that our allocations really range from very small amounts to up to $12 million a year. So we didn't think it made sense for, and we heard from our tribal partners around the country when we did consultations, that it was very important to be careful about these new requirements. And so different standards that you just heard me talk about would apply to different tribes based on the size of their allocations. And you can see that we have just 34 in the large allocation group, whereas we have 153 tribes with receiving less than $250,000 a year from us. So we did really think it was important to recognize that. Just to give you a basic sense of this, because I do encourage you to go to the other webinar to get the full report. The large allocation tribes are really going to be subject to the majority of CCDF requirements, whereas the medium and smaller allocation will have fewer apply to them, as you can see here. One thing we did make sure that we want to clarify is that the health and safety provisions are so critical to this law and so important to our children and families that those are applied across the board. And we do recognize that our partners will have some tweaks and things that they'll need to think about in terms of applying those to make sure that they're appropriate and culturally appropriate for their populations, and we recognize that. However, we did want to make sure that health and safety provisions and criminal background provisions were applied across the board. So now we can conclude and we can say, boy, you probably have a lot more questions, and there's other things that you might want to know. And so here's a way for you to let us know those things. For additional information, you can see the link. And to submit questions, please use this email address. We also want to clarify for anyone who out there are hardworking CCDF administrators, they can continue to submit their questions through their regional program manager, and we will definitely work with them through that process to make sure they get their questions answered as soon as possible. In conclusion, this is a great day for children and families. It's going to be a lot of hard work, no one doubts that, but it's worth it because we're really going to make a tremendous difference for the children and families in this country. There's no way that this rule can be successfully implemented without the help and support and the continued thanks to everyone on this call. We really look forward to continuing the dialogue about how to implement this program the best way, how to support you in the efforts to implement. And we are working with our technical assistance providers every day to think about how best to do that. So we just want to say thank you for your attention. Thank you for everything you do for children and families, and have a great day.